The Office of the Public Protector has painted a bleak picture of conditions that health workers are being forced to work under as the country continues to battle with COVID-19. The institution has found there are issues with the procurement of PPE, among other things. The Public Protector releasing her investigation reports for the third quarter a little earlier today. The probes were conducted in various public hospitals in 5 provinces.
There was insufficient procurement, distribution and provisioning of personal protection equipment to ensure that the staff and the COVID-19 patients were adequately protected from the surge of the pandemic. It was a cause of concern that the PPEs were collected at the warehouse and they were procured by the department and not the hospitals themselves according to their personal needs. There were no dedicated drivers appointed to collect the PPEs at the warehouse, and as such, this contributed to the delay in receiving of stock. Hospitals did not have sufficient PPE. Centralization of procurement in general is a huge challenge for these hospitals. At some hospitals, staff are required to use one PPE for the entire day, even if they have to go out on lunch and back into duty again. Some wards were not provided with appropriate PPEs. Only doctors were provided with full PPEs and not all medical staff in some instances. Some were required to reuse the masks. An incorrect PPE mask were procured, such as the usage of the N95 PPEs vis-a-vis the KN95. There were incorrect sizes ordered. Inadequate protection of healthcare workers and other staff members due to lack of PPE. Nurses only allowed one bodysuit per day. Incorrect sizes of these suits, which resulted in immediate tearing in some instances. Nurses were forced to wear bodysuits even if it is torn, thereby risking their health.
Well, that's clear evidence of a healthcare system that is under increasing pressure as we battle the second wave of COVID-19. More on that when we continue.